In the UK, there are almost 700,000 people living with dementia. The number of people aged 65 years and over in the East Midlands is projected to increase significantly from 733,000 to 1,099,300 by 2025. This increase in population in this age range will have a dramatic effect on the projected number of people with dementia within the region. This is the story of the East Midlands journey over the first year of the strategy.
The dementia strategy was launched in February 2009, and it was my role to get people involved who were currently living with dementia. What we did, we started a discovery programme of actively listening to people living with dementia and their carers about what was working well for them at that current time. This led into creation of a regional vision where we pulled a lot of people together in one room. We spent the whole day looking at what it would look like if we had a dream service. Appreciative inquiry is a new way of thinking. Traditionally in public services we look at the problem, we try to resolve that, but that tends to lead to isolation of that problem. What appreciative inquiry does is look at the whole system and works on what's working well.
The East Midlands Strategic Health Authority held a series of discovery meetings in which people with dementia and their carers talked to each other about what living well means to them.
You need to talk to me, you need to listen to me. You don't need to listen to what the professional down the line or the nurse across the road says. You need to listen to me, what I want. And I suppose part of that has to be individuals. We're all individuals at the end of the day. It's no good putting one set system in and hoping it's going to cover all. It won't.
Being able to do things that I didn't think I was going to be able to do. I've been able to do almost anything that I want to do.
Living well with dementia. To me, is the help that I get at home, the friends that I've made through dementia, my family, but most of all my husband. The time spent with him. Unfortunately, he has lost the ability to speak, but I do on occasions get really big smiles from him, big hugs, and lots of kisses. So from that point of view, that's my living with dementia.
An early message was that we are in it together. This is something that can affect everyone and will become a real challenge for us all over the next 50 years. This core group of people with dementia and their carers worked together to plan a regional summit meeting.
What would I like to see coming out of the conference in October? Real evidence that the people that can make a difference have listened to what's being said by the actions that they take and the changes that ensue from those actions.
I think I would like people to be able to have their diagnosis earlier and be aware of what help and benefits are available to them. They might not need them right away, but they need to know what's there, what's out there for them.
I'm hoping to make a change. Because I've seen the system, I know that it's not right. The only way that we can change the system is to stand up and say, this is not right, this is not what we need. So the time is right now to stand up and say, this is the time to make the changes. You need to listen to people, what people with dementia have actually got to say. You need to respond to that and you need to change. Time is now.
Their stories and wishes were captured on film, in writing, as pictures and as posters to inform the regional summit.
At the regional summit we had 180 people and we were really conscious to get a real diagonal slice of staff to be attending there. We wanted staff who were working on the front line, we were wanting staff who were managing services. We had managers there from care homes, from the acute hospital, we had staff from the ambulance service, from the voluntary service. So we tried to ensure that across the East Midlands we had lots and lots of different people that were there who would be affected by the decisions that we made. We used art for people to be able to express what they were thinking, what they were dreaming about, and people said that they found that really helpful because they had a lot of information in their heads, but getting it down on pieces of paper was making them able to understand the system more, but also enable creativity. So when we're looking at new services, it was getting people to think slightly different about the traditional services. The regional summit gave us a regional vision, so people were able to go away with that vision and try and implement it into their local areas. So they took stories away with them about what a perfect service would look like and what people really wanted out of that service, and all of that fed into the workshops. So the workshop was a process about getting from A to B, but what the vision did was get people focused on what local people really wanted.
Workshops were held in Northamptonshire, Leicestershire, Derbyshire, Nottinghamshire and Lincolnshire between November 2009 and March 2010.
In facilitating the workshop, we started really looking at what all the localities wanted to do and what they wanted to get out of service improvements around the dementia strategy. And we needed to run 25 workshops across the whole of the region. That's a massive, big project.
We visited each location at different stages of their discovery journey. In the first workshop, commissioners, professionals, people with dementia and their carers came together to map a baseline of current local services and to imagine what their ideal service would look like in the future. The sharing of information brought people together to produce thoughts of a common vision for which dementia services should be available in the future.
The success we would like to see is a seamless individual focus of service accessible by all. We'd like to see a directory of services, and we'd like to see more networking. We think it's essential, and forums, etc. to carry on.
We would like a charter for dementia where users and carers are made aware of what good practice is and what they can expect from a service.
A needs-led, person-centred, multidisciplinary service that is outcome-focused with carer support right through the journey, that incorporates a point of contact in a crisis and sits alongside information, training and upskilling for all staff, regardless of whichever sector they happen to be in.
Participants were amazed to discover local services they had not known existed and explored areas of duplication and overlap.
There was a lot of what seemed like duplication, but it's a case of different services with the same name. So we were saying, you know, are you talking about the same thing or is it something different? And sometimes clarification might be needed.
Having found out which services are currently available, they were assessed between mild, mid and later stages of dementia, focusing on how they met the needs of people with dementia and their carers. This exercise was designed to highlight the gaps in the services and how they could be improved.
In terms of training for carers, again we hedged our bets. We sort of went through a full gap, suggesting that there's nothing dementia specific, may be right or might be wrong.
Training was highlighted as a gap for everyone. Using the information from the previous two workshops, the dementia classification was split into 4 stages, ranging from early onset to end of life.
Our first one was that we looked at a tipping factor might be the progression of the disease, so somebody whose dementia was actually progressing, and we felt that that could be balanced by early diagnosis and treatment, help for people to stay normal, and by that we felt that people who are enabled in an enabling environment can actually hold back the symptoms. It might not stop the progression, but being treated positively and working in a very positive way helps people.
By including people with dementia and their carers in these conversations, we are basing our knowledge of what tips people into greater need on real-life experiences rather than guesses.
So our dementia service we would want to hold its own budget, and then we would be able to access the services that the people needed rather than having to access a bit of money from here, a bit of money from here.
You should be able to access in effect, a hospital at home. You shouldn't have to go into a necessarily when you provided respite. It should be respite on demand. It should be overnight or a weekend if that's what you need.
What we would particularly